It's Mary Bordeau. I'm here to give a skin health exam, HEENT and neuro. I'm going to first start off by scanning the room for any cheat sheets. And then the floor. Okay. So now I'm going to start off by going to the patient. I'm going to go to check the patient's chart to make sure the doctor ordered an exam, making sure that I'm going to the right patient as well as going into the right room and right examination. I'm going to walk into the patient's room by knocking on the door, and then I'm going to walk in and present myself. My name is Mary. I'll be your student nurse today. And then, hi.
Hi.
And then I'm going to go ahead and wash my hands, provide for privacy, and then I'm going to start by looking at the appearance on my patient. The appearance on my patient seems to be relaxed, normal for the mood. Patient seems to be doing great at the second, but I'm going to go ahead and start with pain. I'm going to ask my patient a few questions before. Hi, Miss Bordeaux. How are you doing today? I got it. Don't worry.
Okay.
Okay, I'm going to go ahead and check two identifiers. And Miss Bordeaux, can you give me your full name and birth date?
Kayleen Bordeaux.
And your
1370.
and she identified herself as Kayleen Bordeaux, 31370. Now, Miss Bordeaux, is there a name preference you'd like to be called?
Kayleen.
Kayleen? Okay. Kayleen, I'm going to start off by asking you, do you have any pain anywhere before we get started?
No.
Okay. As well, do you know why you're here?
Yes.
Did the doctor inform you that you were going to get a skin health exam?
Yes.
Okay. Now, I just wanted to make sure that so that she would clarify that we both clarified that she knows what she's getting and I know what she's doing. Now I'm going to go ahead and ask my patient to sit up because my patient identified that she does not have any pain, so I'm going to have, if she did have pain, she would be, I would rate the pain with PQRST. Next, I would say my patient's appearance now. My patient seems to be relaxed. My patient seems to be well-groomed, clean, hair cleaned, brushed, shampooed. Her posture is erect. She doesn't seem to have any kyphosis going on. Patient's muscle movements are to herself. No involuntary muscle movements, no involuntary jerking, no involuntary any movements. They're all normal findings per my patient. Next, I'm going to go into behavior. My patient's behavior would be followed under the, she is dressed appropriately. She's making appropriate her facial expression that has appropriate facial expression for the mood. ABC. My C is cognitive. My patient's cognitive, she's able to, by checking cognitive, I'm going to have to ask her a few questions. Kayleen, can you answer me a few questions? Can you tell me where you are?
Home.
Can you tell me what day of the week it is?
Sunday.
Okay, can you tell me what year it is?
2018.
Can you tell me who the president is?
Yes.
And his name is?
Trump.
Trump. She's identified 4 things, so I'm going to put her in an ANO times 4. So her cognitivity is normal per the patient. She's able to be coherent and she's able to talk appropriately. Her thought process, by doing her thought process, I'm going to ask her a few questions. Kayleen, what does an apple and an orange have in common?
Or fruit.
Okay. What does ocean and a lake have in common?
Water.
Okay. Perfect. Her thought process is well beyond normal for the patient. I did not identify that since my patient is sitting, I would be at an eye level to my patient versus standing over my patient, but the way this is going, I'm going to have to stand over my patient in order to ask her questions. Because in a normal setting, I would be sitting next to my patient at a 45-degree angle. Next, I'm going to go on to, I'm going to check out her skin. Okay, Kayleen, can I borrow your arm? Okay. Her skin seems to be normal and paler to the patient's ethnicity, normal and paler. Her skin is warm and dry. This is normal for her. I don't seem to see any lesions, abrasions, anything, no moles anywhere. Miss Bordeaux, do you have any moles on your body, or do you have any lesions on your body, or anything that's abnormal that you've wondered about?
No.
Okay. Do you have a history of headaches at all?
No.
Okay. So now that we've gotten over all of that, I'm going to check her trigger, and this is her hydration. She's doing very well, and she's very well hydrated. Miss Kayleen, can you tell me how much you have to drink on a normal basis?
3 to 4 cups of water a day.
Okay, that's normal, and that's very good. She keeps herself well hydrated. So her A, B, C, T are all in within normal limits for the patient. I'm going to go ahead and move right into the cranial nerves. Cranial nerve number 1 is your olfactory, which is your smelling. I'm going to ask her questions as we go along. Kayleen, have you had any problems with anything, smelling anything lately? Have you noticed any drainage, anything?
No.
Okay. Have you noticed any abnormal smells when you are in any areas? Have you been exposed to any chemicals that may change the way you smell?
No.
Okay. I'm going to have her close her eyes, and I'm going to do a smelling test on her just to check it over and make sure I have verification. Kayleen, when I come across, can you tell me what this is?
Vanilla.
Okay. She is correct. It is vanilla. You can open your eyes now. Okay, next we're going to move into the optic nerve. The optic nerve I would normally do with a Snellen chart. So I'm just going to start moving into asking her a few questions. Kayleen, can you tell me a little bit about yourself? Do you wear glasses or anything?
Yes.
Okay, you do. Can you tell me how often you go to the eye doctor?
Every couple of years.
Okay, when was the last time you went to the eye doctor?
A couple months ago.
Okay, so you had a little bit of a change. Was there any change in your vision since the last time to this time?
Not really.
Okay. So her olfactory, I didn't say that olfactory and her optic nerve are both well intact. Now we're going to go into 3, 4, and 6. Her 3, 4, and 6 is oculomotor, her trochlear, and her abducens. Now I'm going to do the 6 cardinal gazes, and when I do the 6 cardinal gazes, it'll also help me with her oculomotor and all of the skills as well, to make sure this CNS is intact. Now, Kayleen, when you see this, will you follow this and not move your head? We're just going to move with the eyes. Over. Perfect. Can you focus in on that light switch over there? And when it gets close to you, will you do me a favor and focus in on it? Perfect. Patient was able to move. All movements were voluntary. They were not involuntary. There was no shaking, no lag, no abnormal movements. I'm going to go ahead and check over your sclera, and I'm going to look at her conjunctiva. Her conjunctiva is pink. And Kayleen, have you had in her sclera as white and clear, which means she's free of glaucoma? Do you have a family history of glaucoma?
No.
Do you have a family history of any eye vision problems, any blindness?
No.
Okay. Now, Kayleen, so her 3, 4, and 6 are all intact. And I'm going to go ahead and move into Perla. That way I can get Perla out. Now, I'm going to shine the light in your eye, and we're going to try, and we're going to see reactive. And I'm going to go to the first eye, and I'm going to see reactive. And then I'm going to see if it accommodates. So we're going to go, her pupils, equal, round, reactive, to light, and accommodation. By doing this, this is going to cover it all. Kayleen, I'm going to come in the side. Perfect. Perfect. Reactive, accommodated. Perfect. Perfect. They were both reactive and accommodated. Kayleen's eye gauge for her eyes, she's at a 4 right now. So she's bilaterally, she's at a 4. Her eyes are equal in symmetry. She seems to have no lag in any of the muscles. And can you do me a favor? Lift your eyebrows. Perfect. So I checked her perla. I forgot to do that with the oculomotor. That's why I asked you to do that. So her cranial nerve number 3, 4, and 6, they're all intact. Now we're going to move on to 5. 5 is going to be her trigeminal. The trigeminal is going to be also known as the TMJ. To know that's the muscle that goes along with the TMJ, the cranial nerve. Now, Kayleen, can you tell me a little bit about, do you have any problems chewing or swallowing anything?
No.
Okay. Do you have any clicks or anything when you move? Can you open them shut? Yep, perfect. Open again? Perfect. I felt no clicking. I felt no abnormal movements. I felt her to do it. She did it all voluntary, and it was all good. Kaylin, can you open your mouth? Perfect. She had good resistance there. Now we're going to move into cranial nerve number 7. Cranial nerve number 7 is the facial. By doing the facial cranial nerve, I'm going to have her do some things. Kaylin, will you smile? Will you make a big frown? Perfect. Will you open and close? Perfect. Now will you puff your cheeks up for me and hold it while I squish them? Perfect. She's able to do that. Cranial nerve number 7 is fully intact. Now I'm going to move on to cranial number 8. That's the auditory. Kaylin, do you have any hearing loss?
No.
Do you have a family history of hearing loss?
No.
Have you had earaches?
No.
Have you had any tubes in your ears?
No.
Okay. So I'm going to do a whisper test on her, and I'm going to occlude one ear, and then I'm going to whisper.
Bookshelf.
Okay, and then on the other side, I am going to whisper.
Open nose.
Yes, elephant nose. She was right. So that means cranial number 8 is intact. Now we're going to go on to 9 and 10. 9 is the glossopharyngeal, and then the 10 is the vagus. By doing that, I'm not going to do the gag reflex on her, but I'm going to check her uvula to see if it's midline when she says ah and it raises. Caitlin, can you open your mouth? Can you say ah? Perfect. Patient's uvula moved midline. It stayed midline and it did raise when she said ah. So cranial nerves 9 and 10 are intact. Now I'm going to move to cranial nerve number 11. Cranial nerve number 11 is your spinal accessory. Kayleen, I'm going to ask you to shrug your shoulders for me. Up once. Perfect. I'm going to ask you to do it again by yourself. Perfect. Kayleen was able to do that. Can you do me a favor? Move your head side to side. Perfect. There is cranial nerve number 11 is fully intact. Now I'm going to move into cranial nerve number 12, which is your hypoglossal. Her hypoglossal is at the tip of her tongue, so I'm going to check that by asking her to open her mouth and stick out her tongue. Perfect. Can you stick it side to side? Perfect. Can you bring it back to midline when you do that next time? Perfect. Okay, can I have you say light, bright, dynamite?
Light, bright, dynamite.
Perfect. She said light, bright, dynamite. You might want to speak a little louder for me. And so cranial nerve number 12 is fully intact. Now I'm going to move into her mastoid process just because I might forget that later. Her mastoid process. Do you feel any tenderness there?
No.
Okay. I'm also going to ask her to check her thyroid. I'm going to ask her to go from side, and then I'm going to go to the other side. Can you bend your head? Perfect. Have you had any thyroid problems?
No.
Okay. Do you have a family history of thyroid problems?
No.
Okay. Perfect. Now I'm going to move into the lymph nodes. First, I'm going to do her preoculars, right here at the front of the ear. Her postoculars, right at the back of the earlobes. And then I'm going to do the occipitals at the back. Then I'm going to move into her tonsillars, is also known as the jugular digastric. I'm going to move into the deep cervical chain, which is deep, and then I'm going to move into the posterior cervical, and then I'm going to move into the superficial cervical, and then I'm going to move into the supraclavicular chain. Supraclavicular lymph nodes, and then I'm going to do the submandible, and then I'm going to do the submental, which is at the front. Have you had any problems with anything, any of those?
No.
They did not hurt when, okay. Now what I was looking for is I was making sure they were non-palpable and non-tender and no pain. And I did not find any abnormalities, excuse me. And so she's doing real, at this point, they were not palpable, they were not tender. And now I'm going to go on to the sinuses. Here's her frontal. Can you tell me if you have any pain? Do you feel any tenderness?
No.
Okay, perfect. She has no pain, no tenderness. Do you have anything, I forgot to ask you back with the old factory, did I have you occlude your nose?
No.
Okay, I will have you do that now. Perfect. Breathe in. Breathe in again. Perfect. Her nose is patent. That's what I wanted to make sure. Now we're going to, after we did the lymph nodes, now I'm going to go ahead and have her do some range of motion for me just for a second so I can get it together. Kayleen, will you do me a favor? Hold your arms out. Go in circles. Circumnavigation. Okay, can I have you adduct, which means bring it to the midline? Can you go ahead and stand? That will be perfect. Go ahead and bring it to midline. Abduct out. Perfect. Can I have you do me a favor? Supination. Pronation. Can I have you flex in? Perfect. Extend down. Perfect. Since we're standing, I'm going to go ahead and ask you to do 2 tests. Will you put your feet together for me and close your eyes? Perfect. That is the Romberg test. I would have had her dolls to do that one for the auditory. Now, I'm also going to ask you to do another test. Can you take your heel to your shin and bring it down your shin? Just like that. Perfect. Can you do it to the other side? Perfect. Go ahead and sit down. Okay, now that I've worked my way down, I'm also going to do the Babinski, and then I'm going to restart from the head to toe. Now, the Babinski test is, I want to find negative findings, because if I find a positive findings, that means that that's an abnormality. And by doing that, I'm going to bring her foot up and bring the pen up, and then bring the other one. Perfect. She had negative for, she is negative for Babinski. So now we're going to go ahead and start from head to toe. Now when we start from head to toe, we're going to start with the hair. By starting with the hair, I'm going to go ahead and do gloves. I'm going to want to check her hair for any lesions, her head for any lesions, I'm going to palpate her head for tenderness. I'm going to make sure that it's free of debris. Kayleen, have you had any hair loss?
No.
Okay. Have you had a family history of hair loss?
No.
Okay. Have you noticed any tenderness on your head at all?
No.
Perfect. Perfect. Tell me if this hurts at all.
No.
Anything hurt?
No.
No. Okay. First of all, I'm going to take my gloves off and I'm going to do hand hygiene. By doing that, I don't have anything but some hand sanitizer, so I'm going to use hand sanitizer. Now, my patient didn't show any abnormal findings on her head. She had no lesions, no skin, no lice, no debris in her hair. She was free of all things. As I said, her hair is well distributed out, well maintained, groomed, shampooed, clean, brushed. Now I'm going to move into her eyebrows and her eyes. Her eyebrows and her eyes are symmetrical to her face. Patient also does have a normal cephalic, normal to herself. I forgot to mention that. Patient's eyes are well beyond normal symmetric for her face. Her nose is symmetric. Her lips are symmetric to her face. Everything is perfectly aligned. Her earlobes are aligned to her eyes as well. Her eyebrows and eyelashes have hair well distributed. Her nasal passages look normal and patent. She has no deviation to the nasal cavity and nasal. Now what we're going to do is we're going to check the ears over. I am going to ask her, I know I already asked you if you had any history of any pain or anything in your ears, any earaches, but I do need you to know, I'm going to touch your tinna, and I'm going to touch your trigger. Do you have any pain or any tenderness on either side?
No.
Okay. Now, normally I would check the ear with an otoscope, but I do not have an otoscope, so I'm going to look down in the ear canal. I'm hoping to find pearly, gray, pink, and there is ceruma present. It is a light coat of ceruma. It is pink and pearly, free of debris, free of lesions, free of anything. So patient has, I'm going to have to go there again. Sorry. Patient is, let me regroup for just a second. Patient's earlobes are well distributed. Patient cerumen is present inside the ears. It's pink, it's pearly, it's normal to patient. Patient's eyebrows are symmetric. Patient's eyelashes are symmetric. I'm going to check patient's nasal cavity. I'm looking for preparations, or I'm looking for deviation. There is no deviation. There is no preparations. It's midline. Patient's lips are pink and moist. I'm going to check inside for mucous mucosis is present. Patient's skin and her insides on both cheeks are present, normal. There's no lesions on the inside of her mouth. Can you do me a favor and lift your tongue for me? Perfect. I'm looking underneath the tongue because sometimes cancer does hang out underneath the tongue. How is your oral? How do you take care of your teeth? Do you brush your teeth normally on a normal basis?
Every day.
Okay. Have you noticed anything abnormal about your skin inside?
No.
Okay. So she is pink. She is normal. There is no the tongue is pink and normal. Her soft palate and her hard palate are both intact. Patient her mouth seems to be normal for herself. She has no cavities. She sees, how often do you see the dentist?
Every 6 months.
Okay, so she does have normal, she does see the dentist quite often. She has teeth are all there. Can you do me a favor and go ahead and press against my hand? Perfect. Can you do it on the other side? Press against? Perfect. Can you do me a favor? Turn side to side. Perfect range of motion for the neck. Does that hurt at all?
No.
Okay. Next, we're going to move into, I know we need to check the carotid artery bilaterally, one at a time. And she is at a bounding +2. Next, I'm going to go ahead and move into checking over the patients. I had her do the balance test. I had her do, can you do me a favor and stand up for just a moment? I'm looking for any muscle atrophy on her. She is able to make all movements very well to herself. Can you do me a favor? I need to do your capillary refill. By doing the capillary refill, I need to hold down 1, 2, 3. By letting go, it comes back at 1. By holding on 1, 2, 3, letting go, and it comes back at 1. Go ahead and have a say it for me. I'm going to, actually, you know what, I apologize. I'm going to have you walk across the floor for me to check your gait out. Patient's gait seems to be doing great. Go ahead and come back and sit down. Patient's gait is normal. It is not wobbly. There is no muscle problems. She does not deviate from one side to the other side. She has no movements that are wrong. Now, I'm going to do a whole recap from head to toe. I checked her hair for abrasions, lesions. I checked her face for abrasions or lesions. She's free of all lesions, nothing on her face. Everything seems to be great. Her eyebrows and eyelashes are hair is well distributed. I'm going to move on to the nose. The nose is normal. It's not deviated, and she has no perforated septum. Now I'm moving to the lips. Her lips are normal pink, symmetrically even on both sides. Patient does have no cold sores on the outside of her mouth. Her ears are symmetrical to her body. There's no abnormal findings on her ears. There's no abnormal findings. Patient's lymph nodes, her thyroid, her mastoid process, her TMJ have been covered. Her capillary refill have been covered. Her range of motion have been covered. Patient's ability to stand, the Romberg, the Babinski test. Patient seems to be fully normal at this present time. And now I'm going to ask the patient, do you have any questions for me?
No.
No? Do you feel okay?
Yes.
Okay, I'm going to just ask just a few more questions. So you said you had no family history of high blood pressure,
No.
no skin cancer.
No.
Okay, so no thyroid cancer, no cancers to be found in your
No.
family to deal with the skin or the thyroid or the lymph nodes?
No.
Okay. Her dental hygiene as well to herself. Now I'm going to assist my patient by assisting her back into bed, and then I'm going to go ahead and get her covered back up. Tell her thank you for your visit here. And I'm going to go ahead and move her table back to her side. Sorry, it's full of my stuff, but now I'm going to do hand hygiene for myself again. And then I am going to conclude by saying the hand hygiene, and I would go out and I would document everything. On my chart, I would document that the patient has no abnormalities to anything, but she did have TMJ. Did we cover the TMJ in your mouth guard?
Yes.
Okay, we did. Okay, so I would cover that with the doctor as well, stating that she does go. I would chart that she has been to her dentist. She has got a mouth guard for her. Do you grind your teeth at night?
He says I do.
He says she does.
So I wear a
So-
mouth guard.
She wears a mouth guard at night. So I would document all of those findings. She is her capillary refill is normal. So at this moment, I'm going to say thank you very much. You guys have a good day, and thank you.